It looks like we have our participants joining. We'll give people a little bit of time to get comfortable in their favorite Zoom chair and join us here at Beyond Insights, our bi-weekly online speaker series largely for professionals engaged or interested in dialogue regarding Ibogaine-assisted therapy for a range of patient situations, including addiction and trauma and some combination thereof. But we've curated these panels to assist practitioners and professionals in understanding the clinical aspects and benefits of Ibogaine-assisted therapy for treatment. Today, we will spend 60 minutes together talking with this team of experts and thought leaders. And I'll invite now the group to begin the introduction. So since we have so many wonderful guests, why don't I start? My name is Tom Feegel. I am the CEO of Beond. We are a network of premium facilities that are based in Mexico, and we use Ibogaine-assisted therapy for the treatment of trauma and addiction. And we use a 5-part delivery model that starts with preparation, continues through pre-treatment, the treatment phase, our acute aftercare phase, and then long-term aftercare. And everyone on this panel will have some strong opinions and insights around how to do that well and most effectively. But to start off our introductions, I'd love to invite you, Deanne Adamson of Being True to You, one of our favorite partners at Beond, to introduce yourself, and then please invite one of our fellow guests to introduce themselves as well. Thank you for being here, Deanne.
Amazing. Well, thank you, Tom and Beond and the whole team for having us. I'm excited to be here and to join you guys for a series of panels as we talk about the treatment of Ibogaine, the purposes of Ibogaine. My role is really around preparation and integration of Ibogaine. So to introduce myself, my name is Deanne Adamson. I started a company and run a company called Being True to You that we began in 2010. And right after I started the company, just coaching in general, I met the Ibogaine community. And so about 12 years ago, my role in Ibogaine treatment and integration started. It was really a fascinating discovery. I come from the background of psychology, mental health counseling. I was a counselor by trade. I've worked in the judicial system. I've worked in the nonprofit system. I've worked with different families in different sectors. I've worked in victim advocacy. And after all of that, I became a counselor, and then I was like, oh man, this isn't really driving my passion. So I ended up starting a coaching business. I didn't know what I was going to do. And within 6 months, a friend of mine said, you should check out my cousin. He has Ibogaine clinics down in Mexico and see what they're doing. And I thought it was kind of bizarre what I was hearing. So I went down for myself to check it out. And I was really blown away by what I saw. And what I saw was people with late stages of chronic opiate addiction and different kinds of addiction and different types of comorbidity who were hearing about Ibogaine treatment and traveling international for these experiences. And through these experiences, 7 days really being gone, people were having major transformational experiences that were changing their life. However, they would go back home and return to the environment that they were in and the mindset and the lifestyle they were in and the relationships they were in. And so it was causing sort of a conflict between their new state and what they had learned and their home life. And so we found quickly that offering coaching after the experiences was such a great way to integrate what they had taken from the experience into their life. And then after that, we realized how powerful preparation is and actually setting the stage before people even go. So over the last 12 years, we have worked with different Ibogaine clinics. We've just worked with people in general who have found Ibogaine. We've worked with into the thousands of people and families, honestly, whether we're just consulting quickly or whether we're actually coaching people for months or even years through these experiences. And so we've been able to put together a lot of materials, recovery materials, coaching materials for individuals, for family members leading up to their Ibogaine experience and then after their experiences. And ultimately, we train and certify our own coaches as well, which we've been doing for about 8-9 years now. So we have a really good system. I've worked a lot of Ibogaine retreats myself. I've been on the board of different Ibogaine centers. I've spoken at a lot of Ibogaine conferences and online seminars and things like this. So it's been amazing to be a part of the Ibogaine community for so long, and then learning about Beond emerging has just really warmed my heart, because I really have a special place in my work for helping people through this process and getting the most out of it that they can. And as we know, there's quite an epidemic of not just opiate addiction, but all kinds of addiction and all kinds of different states of suffering. And this is a medicine and a tool that could really transform a lot of lives, and really doing it in an ethical, effective, and fun way. So anyway, that's a little bit about my background. Just sticking with the ladies, I'll turn it over to you, Adriana, to go next. Thank you.
Thank you. Thank you, Deanne, and thank you, Tom. My name is Adriana Figueroa. I am the head psychologist here at Beond. My background and experience has been for the last 13 years working in addiction and trauma, and the last 5 years specifically with Ibogaine-assisted psychotherapy and as a addiction interrupter. And I've been privileged and honored to see how Ibogaine has really, like Deanne was saying, transforms lives. It's amazing to me to be able to see how they come, how the client comes, and then how they leave. And it does have to do a lot with preparation and their expectations and managing those, understanding and their commitment. And it's a pleasure to be here with all of you to talk about the processes and how we can best prepare anybody that's interested in taking Ibogaine, and hopefully making them feel safe enough to try this very important plant medicine. I'll keep it brief, so I'll turn it over to Dr. Blokhin.
Thanks, Adriana, and thanks for Tom for putting on this panel series and inviting me. I'm Ben Malcolm. I'm a board certified psychiatric pharmacist by training. I founded a website called spiritpharmacist.com, which focuses on the interface of psychiatric illness and medications with psychedelic therapies, or psychedelics generally. I recognize that psychedelics can sometimes be used in other types of settings as well. So I'm a little bit more of a generalist in that I consult with a variety of providers, organizations, and persons about their medications and psychedelic therapies. And my goal in all of it is not necessarily to be one-sided or advocate one therapeutic solution as the ultimate thing for everyone, but really to understand where that individual is at in their healing process, what they want to do, and try to come up with a plan that's safe and reasonable that they can agree with and just be on board with generally. So I'm really excited to be here and to begin this relationship with Beond, because Ibogaine is different than other psychedelics. It has different levels of medical risk, it has different types of drug interactions, and it has different levels of benefit and efficacy, particularly for addictive conditions with opiates and probably other types of stimulant narcotics too. And this is an area that we are really hurting in at this point in time. Opiate addiction is a public health epidemic at the moment. There are record numbers of people being harmed and dying in the United States every single year. There are 0 FDA-approved treatments available for stimulant use disorders out there, and Ibogaine really seems to be a wonderful candidate to help so many people, yet really does need a higher level of vigilance and caution when thinking about medications and drug interactions. So that's what I'm here to contribute, and I would love to hear from Dr. Felipe Malacara next.
Well, thank you very much. Yeah, definitely something that it's extremely important is that we are right in front of a terrible pandemic of drug use and abuse, and most of these drugs have caused large amount of casualties all over the world, and they are not being addressed by not only the US, like mainly no government around the world is really caring about what is going on with the abuse of opiates, the abuse of stimulants like cocaine, amphetamines, methamphetamines, and crystal meth. And well, not only these, but the big chance, the big opportunity that we have of proving, or at least trying to prove, what it's been said about Ibogaine and about helping mental problems, psychology, or psychological diseases, and trauma and anxiety and depression, because there's a lot of case reports and a lot of data that tends to show that it is useful, but unfortunately there's no been any like peer documented or clinically evaluated data that can give us like evidence-based clinical results about it. So the opportunity of doing this to try to see if it is true, and then if it is as we expect, as we hope, as we want, true, being able to offer this option of treatment, this insight oriented Ibogaine therapy, I think it will be a totally world change in the way that mental health, including addiction and trauma, is addressed nowadays. And I am extremely excited and extremely grateful of this opportunity Beond has given to me by turning their side to me and leading this team right here in Mexico, as we are doing right now. So I would like to do whatever is on my reach and on my maximum extent to try to get the most profit, not for me, but for the people that requires, that needs this kind of treatment and this kind of assistance and assessment to rebuild or regain the lives that they really deserve and that they really need to get back. And well, finally, but not the least, please, Yuriy, if you want to introduce yourself.
Thank you, Felipe. Hi, everybody. I'm Yuriy. I'm the founder of a company called Homecoming, which is a technology platform for preparation and integration of psychedelic-assisted psychotherapy. The vision for the platform really has emerged out of my prior work in the nonprofit community with veterans with PTSD at the Heroic Hearts Project, where I was one of the founding team members. And it was really, for 5 years, we've been able to figure out how to provide access to psychedelic therapies for these veterans. But just time over time, we saw that preparation, integration, unless it's provided, and actually we've been lucky to work with Being True to You and Deanne's team on that front at Heroic Hearts. And like that was like, without that process, it was really kind of challenging to achieve these sustainable and safe and efficacious results. And the idea behind Homecoming is that obviously technology will never ever replace the human and clinical and coaching judgment and expertise. That's just impossible. But there's a role for technology to complement and amplify the work of coaches and therapists and really kind of alleviate some of the more administrative and kind of tedious tasks, as well as also, especially more strategically so, to fill up that time in between the therapy sessions during the preparation phase and during the integration phase, when clients that are on their own in the real world, and a daily nudge and daily sense of guidance and structure in terms of actions and information and connection to others that they can undertake, that will strengthen their preparedness, that will strengthen their sense of clarity around what are the most constructive steps to integrate the experience. That's really the vision behind Homecoming, and we currently are working with Beond, and feel very privileged to work with the team at Beond on supporting the preparation and integration process for the community getting treatments at this clinic, and excited to participate on the panel. Thank you.
Thank you, everybody. Thanks, Yuriy, for that introduction. So kicking off a little bit, when we think about the spectrum, the continuum of care at Beond, everything we do starts with and ends with safety: psychological, emotional, spiritual, and of course, medical safety. And everyone involved makes that a priority. However, everyone involved has a different skill set, a different level of experience, and a different type of training. So what I was hoping to do today, with the interest of understanding how we each contribute to that ultimate goal of safe and effective use of Ibogaine-assisted therapy, to start with preparation and to think first about the earliest stage, and ask you, Dr. Malacara, to even speak here and before us all with Dr. Malcolm about what are we really looking for, and what are we really trying to do in that earliest pre-evaluation, pre-treatment phase, before we even get to the coaching with Deanne's team, before anyone has gotten the access code from Yuriy's team for the app. What are we looking for to make sure we really understand the information we have to ensure medical safety at that earliest stage?
Well, basically what we are looking for is to try to avoid having the need to reject a patient when it is already at the facility because of whatever issue. We are committed to be sure, or try to be as sure as possible, that there will be no cardiac problems, there will be no metabolic problems, there will be no hepatic function problems that may void a patient to receive the treatment properly. That's why we are very interested on having information about what the patient is taking, what is his interest or her interest in Ibogaine, what are the goals. So all this stage of pre-admission or pre-treatment, even before getting engaged with Be True to You or getting engaged with any other part of the process, I think it's extremely important, because it's, as you have said, safe is the most important commitment in Beond, and it's safe all over the place, around medical safe, psychological safe, mental health safe, and process safe. So if we are able to retrieve the information that we really need in order to know that the medical part of the process can be taken place without any major condition that will interfere or jeopardize the procedure, I think it's crucial. And besides that, and on top of it, while patient arrives, we know that mainly with chemical substance abuse patients, sometimes we will need to deal with the problem that because of whatever reason, they may have kind of an acute relapse just before arriving with us. And sometimes we need to prolong staying with us just to try to, and of course, obtain an adequate balance of metabolic function to recover the liver function, so we can assure that the patient can be treated. There will be moments where we need to consider keeping a patient longer in order to be able to administrate a safe treatment and not just deciding to give the treatment on a jeopardized basis or denying a treatment that probably in a reasonable amount of time could be administered. Nevertheless, the patient make something slightly wrong that ruin his or her liver or metabolic condition. That's what I mainly try to stress about what we're looking for.
Thank you. Thank you very much. So turning to you, Ben, Dr. Malcolm, sorry, but really trying to go a little bit deeper and think about the interactions between Ibogaine and other substances, both illicit and legitimate prescriptions that people may be on. What can you help us understand about ensuring first safety and then efficacy?
Yeah, so I think like good screening processes start with a good intake form, and you probably want to have a number of different elements on that intake form and perhaps different styles of asking questions. Like if you know that Ibogaine is contraindicated with drug X or with condition Y, maybe you want to have a specific checkbox about that kind of contraindication. Whereas if there are maybe medical conditions that people may have that aren't absolute contraindications, then more open-ended styles of questions where they can just list things out is a little more reasonable. I think beyond just kind of, I have depression, I have addiction, these are very superficial level types of answers. Some people have been to psychiatric hospitals, rehab centers, have tried other options previously. I think this is all information that's important that you want to understand. How stable are they psychologically at this point in time, and then kind of what is their history as far as psychological stability goes. Getting an idea of medications, herbs, supplements, over-the-counter drugs, allergies, as well as any recreational or illicit substances people are taking, and not just which ones, but what quantities, what frequencies, what routes of administration, all kind of play into the idea of like gathering enough information that you're getting a good picture of not just this person's medical conditions, meds, but their life. I mean, I'm thinking even broader, like social information, their current support network, like do they have people in their life, a team around them already or not? And all of these things are going to play into your screening. As far as thinking about like medications that are going to be red flags, I'm thinking about medications that prolong a specific part of an EKG tracing called the QTC interval. There's many different types of medications across various classes that have this ability to prolong QTC interval. Ibogaine and nor-Ibogaine's metabolite can also prolong QTC interval. Mixing them can put you at risk for certain types of arrhythmias, which can actually be fatal. Medications that just affect heart function in general. Maybe they slow heart rate, and maybe people that are on cardiovascular medications, it's a marker of underlying cardiovascular illness. And you may need to understand what the severity of that cardiovascular condition is, even if the cardiovascular medication doesn't present a strong type of interaction risk. Ibogaine is metabolized to noribogaine by a specific enzyme in the liver called CYP2D6, and many drugs can interfere with this enzyme's ability to metabolize ibogaine or its metabolite and increase its concentrations, which could put persons at risk of a toxicity. You know, ibogaine is a strongly psychoactive and psychedelic types of substance. So considering the other psychotropic medications people have, and then, you know, if you're, you know, specifically thinking about using ibogaine for a type of addiction or opiate addiction, you know, there are certain types of opiates, usually the kind of natural occurring ones like morphine, for example, that seem to play pretty well as far as the preparation leading up to ibogaine. And then there are longer acting opiates or opioids that are prescribed for opioid use disorders that may need to be changed out and switched to kind of shorter acting formulations. So in a whirlwind nutshell, that's kind of my list of medication classes and their properties that are the biggest red flags in my mind.
That's really helpful. And, you know, look, we have spent, I don't know how many hours writing, rewriting intake forms to make sure that we are trying both to gather the information that our physicians and our nurses and our psychologists need to really prepare this guest, as we call them, for the safest, most effective experience. But there seems to be a balance between this term form and its function that has to be navigated carefully. You know, it's something that turns into much more of a facilitated experience where we really do have to first encourage the person to engage, but then oftentimes take them through this experience to ensure that were they in the right state of mind when they completed the form? Are there any typos? Did they get it right? And so on. And it's a service. That's the only way to describe it. It's truly a service, a support at that earliest stage of information gathering, which is so crucial, as you pointed out, for so many reasons. Once we've done that, though, and our doctors, Dr. Jeffrey Camlett, our Chief Medical Officer, Dr. Felipe Malacara, who's with us today, have the information they need to hopefully approve a guest for treatment, we then have the opportunity to go a little bit deeper and to engage those guests in additional discovery. And to do that, we rely on partners at organizations and experts at Being True to You. And Deanne, as the founder and CEO of Being True to You, can you help us look more carefully at that earliest stage before they've gotten access to the app from Homecoming and they've got all their materials? We're in touch with these people, and what's really going on for that coach? What's their goal on behalf of that guest to help them at that earliest stage ensure their safety and preparation?
Mm-hmm. Yeah, happy to speak to this. You know, first off, it's such an honor for our team to be able to support you in this. We've had a lot of experience and worked hard over the years to do this. And it's one of my favorite things to get to do is to support you guys and to be able to support people through this process. And like I said, we started in the integration phase of it, and then we by default, we were helping people in the preparation phase that just had to wait for their treatment. And then we saw pretty clearly that, wow, integration does begin in preparation. And when you're talking about safety and the efficacy of this treatment, you want to start preparing beforehand. And there's a lot of reasons for that. So I'll go through a couple things fairly briefly here. I mean, first of all, you want to be well educated. I think that's important, so people do understand what it is that they're stepping into. They understand the significance and the seriousness of such a powerful medicine, an entheogenic experience like Ibogaine. There are times when family members hear about this and then they just like send their loved one down for the treatment and they don't really know what they're getting into. So I think when we're preparation and safety and efficacy, first we want to make sure people understand what they're saying yes to. So I think it's important for them to do their due diligence on the medicine itself, and then of course understand how the process works so that they know what to expect. Other logistical things that can really, in ways that coaches can support this process, is just speaking about travel. Believe it or not, a lot of people's fears will come down to traveling to another country, being away from their source of substance or drug, and being on the road. And, a lot of times when I was talking to people, I thought they were scared of taking the medicine. And they're like, I'm not scared of that at all. I'm scared of travel. I'm scared to be away from home. I'm scared to cross. And so we realized just helping people to be alert when they're traveling, to be well prepared, not to be traveling with anything illegal, and maybe even to have a travel buddy if necessary, coming down there, that can really help protect them physically and mentally, because they get in their head and they stir up, and sometimes they won't show up for treatment. They'll disappear down in, a different place. And, I think there's a lot centers can do, like you guys do, to ensure their safe arrival, but coaches can support that conversationally in advance as well. Mindset is really important. With mindset, you want to help clients to develop a curious observer mindset. So they, instead of judging their thoughts or obeying their thoughts, or getting tied up in their fears and all of these different voices in their head that are telling them to doubt or second guess what they're doing, it's like, instead, we're just observing what's coming up. We're taking note of it. And through that, we're acknowledging the severity of the situation and remembering, why am I choosing to do this treatment? Why is this important to me? Because that maintains a sense of courageousness and a sense of reassurance. And it also gives the mind something to do when we understand what is the work. The work is observe my thoughts, don't obey my thoughts, don't give in to them, just be aware of how my mind works and how my mind or my alter personality might try to talk me out of this. So there's a lot that we're doing mentally to prepare. Physically, we can really reinforce what the doctors here are saying, just talking about the importance of hydration, the importance of cardio, because of Ibogaine and having such a strong cardiac response. It can really elevate the heart rate, and it can really depress the heart rate. And so it's really helpful when clients coming in can do, at least 20 minutes of cardio daily for the week before they come in. So it's things like that, starting to cleanse the body as much as possible, cutting down on a lot of the junk food, replacing it with more nutrients so that the medicine can work deeper in the body and it's not having to work through so many layers of toxicity and so much of that, bad gut biome that can really affect the medicine. And just learning how to relax too, how to ground. I think that's part of the body, whether it's progressive muscle relaxation or just understanding like what's going on in the body and tuning into that and finding different ways to sort of either alleviate the pain or to tolerate the pain, and sort of just relax the mind and body. I would say from a personal perspective, it's important for clients to start taking responsibility for their current situation, because a big part of the efficacy of this treatment is that a person understand where their work lies. And so in the preparation phase, we'll certainly be talking about that so that when the work emerges, a client is not escaping it or projecting or blaming. It's like, okay, the fear is here, the anger is here, the irritability is here, the chronic pain is back, the headaches are here, whatever it is. It's kind of like, okay, this is my symptom. And I get to employ something to support me through this. And so I think that's a big part of it. And again, tuning into the reasons, why am I going down here? That's really going to provide a lot of strength, a lot of reassurance throughout the whole process, which is going to help them ultimately to make good decisions. Like I said, stay alert, stay in the process, stay trusting, ask for help when needed. I don't know if we'll get the chance to speak more on preparation, so I'll just quickly say, you know, we're also looking at people's life, like how to set your life up, your home up, how to communicate in your relationships, what your needs are going to be when you come back, and how to set up accountability systems and a community. So when you return, your community is not like, what'd you go do? You know, I don't understand that. That sounds odd, and they can't support. You've already prepared your home environment, your recovery community, your network. You've spoken to them about what you're doing, at least to the degree that a person feels comfortable. So these things are important. And you know, there can be spiritual preparation as well, just starting to look at what is the meaning in suffering, the meaning and significance in getting addicted, and how can we start to let go of some of the spiritual blocks that we have that are holding us back, because, you know, after all, addiction and recovery, you know, has a large spiritual component to it. So in a nutshell, those are some of the things that we do in that early phase.
Wow, that is very comprehensive and in-depth, Deanne, and we're very proud to be developing, co-developing, refining each of those tools and exercises that the coaches go through with the guests before they even leave home, to set up their success, to ensure their safety, and prepare them for the experience they're about to have.
Mm-hmm.
You know, it's kind of tricky right now for me to figure out who do I go to next, because I've got, you know, our head of psychology who takes the handoff of the guests' information as they're being admitted and prepares our pre-treatment phase. And we have Yuriy, who's sort of the glue in some ways between the information that we're providing, the orientation guides, the agreements and so on, the exercises, and the guest experience. So I'll invite Adriana Figueroa, if I may, sorry, Yuriy, to help us understand. You get the inbound information from that coach who's leading the preparation phase. What happens next? And if you would, how is safety in particular continually a priority in that pre-treatment phase for you?
Of course, thank you so much, and for that wonderful explanation that Deanne mentioned. Safety, like you said, is the most important thing for us medically, psychologically, like Dr. Malcolm was saying, from the intake process, from the form that they fill out, the client fills out. We are asking the questions. Do you have a history of psychiatric problems? Have you been hospitalized? Do you have a history of psychosis? Things that are very important for their psychological safety. First and foremost being, if they have any diagnosis of psychosis, that would be something that would be sort of a red flag for us. And like Dr. Malacara was saying, we don't want our client to come and then not be able to take this treatment. So that is something we're always looking for. When they come to Beond, I am as well, my team and I are doing an evaluation to see where they're at. After Deanne and her team at Being True to You have given us information on where the client is at in their life in general, in their home life, in their professional life, why are they seeking this specific type of help with Ibogaine and plant medicine? What my job here is to prepare them for the actual treatment. What does that imply? A lot of it is psychoeducation. A lot of it is what to expect after they take their primary dose. And they're in this, obviously a lot of emotions come up, a lot of, healing. The healing really starts. They see, sometimes they describe it as they see that their whole life flashes by them, and they have to sort of process a lot of important things and that happen during their life. So we have to prepare that, what we call the gray day. And the gray day is after the primary dose that we provide them. if they're candidates. And like I said, if all the safety protocols are in place, we have to be able to give them contention. We have to be able to prepare them that, like, Deanne mentioned, we can't be critical of ourselves. We have to be forgiving, and we have to be compassionate, and we have to let the process flow. Before that, besides logistical questions regarding like, how long am I going to be in the treatment room? How long does this last? Am I going to be monitored? Those are those fears that a lot of our guests might have. We try to address them. We try to make them feel as safe as possible, because for this type of medicine to work, we have to be able to surrender to it. We have to be able to really be able to let go and trust it. So a lot of the preparation is that, working on their intentions based on what we have of the information that the coaches relay to us. And not only that, but the intake forms, like I said, as well, our own interviews with them. We try to set their intentions and what do they want out of Ibogaine, this specific treatment. And we try to go in a little bit deeper than, for example, if it's a substance abuse client, they might say, well, I want to stay clean. Okay, but what does that mean? Sort of what Dr. Gabor Mate, who was in the panels a couple of weeks ago, where is the pain? What is it that we're trying to uncover, prepare them in their intentions, sort of focus them really, and prepare them for the work that it's going to take. This is a beautiful tool, a really valuable tool, but that the work has to come from them. So a lot of that preparation is saying, okay, this is great, but we have to look at the longer picture. We have to look at the long-term aftercare. And I think, to be honest, a client said it best, and this mantra she got after her Ibogaine treatment, and the whole preparation and the whole process, I think, can be summed in trust, surrender, receive. We have to trust ourselves. We have to trust, the client has to trust that the medicine will, if you trust yourself to allow that the medicine will work, it will work. And not only that, trust that you can take that information and surrender to it, surrender, accept, and then receive what the insights are. That's why our program is called Insight-Oriented Ibogaine. So we take that and then we form what an aftercare plan would look like. But preparation, like you said at the very beginning, is in every step of the process. From coming home to a different country, like Deanne saying, what do I have to take? What do I have to eat? What do I have to do? What medicines do I have to titrate? As Dr. Malcolm and Dr. Felipe was saying, how can I best prepare myself physically? But mentally, it's sort of, am I ready for this change? I have to want it. I have to be ready for this change. And that's something that we evaluate. We evaluate how open our client is, and we try to help them be the most open they can, so that they can receive this medicine. And obviously with the help of technology, with, for example, like Yuriy and Homecoming, it makes our lives as clinicians a little bit easier, because they're with them on 24, a daily basis. Sometimes we can't be there 24/7. The app will remind you, hey, take a breath, ground yourself. So that is sort of what our job here is when we have our guests at Beond, to make them feel safe, to give them psychoeducation, to process their to process their safety protocols, and to help them heal.
Beautiful. Thank you very much. And of course, we do have medical staff on site at Beond 24/7. And yet there's a need for even more intimacy and even more connection. And I happen to have my Homecoming, my Beond Homecoming app open right now. And Yuriy, I'm going to ask you why it does what it does. So it says Tuesday, May 3rd. Good afternoon. This is your plan for today. And it asked me to do a check-in. And then throughout the day, it's invited me to write about my community. Who do I consider my people? It's encouraging me to let go of something in a spiritual exercise, and even was encouraging me to participate in some physical exercise. So check-in, social engagement, how do I feel connected with my people, and then a spiritual practice. How did you figure that out, Yuriy? Like, why those things specifically for the Beond guests and for an Ibogaine-assisted therapeutic benefit?
Great question. So generally, the approach we have taken on at Homecoming is based on a few principles. Each practitioner, each clinician and coach, they have their own clinical or treatment philosophy. And our goal is to really help them embody that philosophy with a companion experience, not really kind of put something of ours and force them to use it. It's just not going to work, and it's not best for the patient. And so we're trying, like at Homecoming, we try to create this canvas, a framework that the practitioners and clinics can really use to kind of put their program in place there. And the very basic framework that we have adopted, though, consciously is the biopsychosocial spiritual framework that's pretty common and dominant in the psychedelic community. It's pretty hard to find somebody who completely disagrees with that kind of meta framework almost. It's like within which you can approach the person's well-being across the 4 dimensions of mind, body, community, and spirit. And we're trying, with the Homecoming, we're trying to recreate this kind of daily moment where on one hand, as you do a check-in, you're able to reflect and find out for yourself how you're doing on those dimensions of well-being. That information can also go to your therapist so they can see a trend line over the days in between the sessions. But also based on that information, we're able to suggest very small actionable steps. For example, if you have been trending low on the social dimension of well-being for the last few days, we can give you a journaling prompt to reflect on what is your most meaningful connection in life and what makes it so special. And it's just one example. And so it's a simple idea, but like we have found in our work with clients and clinics and providers, that simple idea allows for the daily kind of sense of a ritual as you engage with the app, as you kind of find out for yourself how you're doing and complete these small, very achievable, actionable steps that get you a sense of certainty and kind of sense of progress. That's like that minimum viable foundation upon which the daily practice of preparation and integration can be built upon. And integration is just really something that's like, it doesn't stop once you have completed like your treatment. It really is a practice that you keep doing. But what we do though, like here at Homecoming, is really kind of as a way to support Adriana and Deanne and everybody at the clinics, at the clinical staff, to fulfill those principles and values that you have shared in those so eloquently, both Deanne and Adriana. So trust, surrender, receive. If there is a small way that an app can support those principles, that's when we feel it's a good day for us.
Yeah, one of the things that I really noticed about the Beond Homecoming app is there's certain sections, Yuriy, where it's asking me to provide some information, to do some note-taking, some journaling, and it clearly says this is not going to be shared with your therapist. It really is kind of like a moment for a moment that matters for my care continuum, but it's just between me and my own reflections. And I thought that was very helpful, very interesting, just to reassure me of that another level of psychological safety. Like, you're not telling on yourself, you're just trying to set that personal psychedelic agenda and begin to refine the roadmap of insights that are the benefit of the Ibogaine-assisted therapeutic experience. So I really appreciated that aspect particularly. So when we get through that treatment phase, Dr. Malacara, are we talking about one dose of Ibogaine? Are we, what is that treatment phase, and are there other aspects to to the treatment that are relevant to the issues that Dr. Malcolm was bringing up around, the earliest stage of planning my aftercare from a pharmaceutical perspective. I obviously want to stay clean, or I want to be healed, but what can I look forward to in terms of interactions or potential contraindications after the treatment phase?
Well, yes, of course. There's a bunch of things that will interfere even before or after the treatment, and patients need to be aware of all of this. And I want to retrieve a little bit of what has been said all over. Like, of course, as Dr. Malcolm has said, we need to be aware of dietary things, like, for example, and just to name rapidly certain things, people that likes using a lot of grapefruit in their diets, they need to stop using grapefruit, because grapefruit would interfere with the ibogaine process. If they are using curcuma, that's something that has to be stopped also, because it interferes in the same cytochrome and the same protein that metabolizes ibogaine. And in the mindset, it's very important, it's crucial, because people coming against their will, most likely the scenario is that even though they feel and they can probably even accept that the medication worked, if they don't want to be healed, there's no possible way to help somebody that doesn't want to be helped. And they will relapse because that's what they really want and they really need to. And they are probably coming to Beond or any other clinic just to satisfy some other's will about, hey, give a chance to this, because this is what you need to do in order to heal your problem, your addiction, whatever. If they are not committed since the very beginning, even though that sometimes they can admit that they are feeling better, it's like, it didn't work because I don't want it to work. Yeah. And on the other hand, there will be people that will say, wow, this thing really works, so I can get to my same old and do what I've been doing until I'm really ready to quit it for good. And unfortunately, sometimes when they are ready, their organism, their kidneys, their liver, their overall metabolism is not ready anymore. And well, talking about how many treatments or how many dosages, it will vary. As I have always said, I don't like cuisine recipes. We are not cooking, or we are not baking cookies here. It's like, it's not something that you can say, okay, it's a primary dose and 2 booster doses, or a primary dose and 3. It depends on how the patient feels, on how the patient evolves. Of course, there's a base protocol, but the protocol has to be flexible, because we are treating patients. We are not treating a disease, or at least that's the point of view that I have about medicine, that medicine has to treat the patient, not the disease, as it is usually conceived by the medical community, that this disease, this is the protocol, this is the primary substance to treat it. If the patient is allergic to this substance, then we have option 2, and if not, we have option 3, and if none of the above works, well, we are going to try to desensitize the patient to option 1 and get back to option 1. And well, for me, that's like a cuisine recipe that sometimes it won't work. So we need to find out several other things. And then after using ibogaine, there are certain substances that are obviously needed to be avoided. Like every single substance that in the brain interacts with the same brain receptors that ibogaine does, even though they were not considered a problem for the patient. For example, if we have a patient that comes because of use and abuse of stimulants, and consider the patient that he doesn't have an alcohol problem, in taking alcohol after the treatment may or might, I would say, interfere with the process, because it will flush away a little bit of the nor-ibogaine that is occupying those receptors and producing certain amount or a big amount of withdrawal or craving or need to reuse what they were trying to leave. So, of course, mindset, preparation, the treatment itself, and the post-treatment are all crucial in this. And something that I heard before is like, we need to think about year-long aftercare, year-long contact with the patients, year-long programs of retreating, not retreating, revising or reviewing how our patient is doing to assure that they can continue in this world of they are getting back to the same old place and the same old routine. And how are they going to address that? How is the accountability is going to be taken care of what is the responsibility that I, as a physician, will inform my patient that, hey, something very simple. If you are in a toxic environment and you have identified through Ibogaine or through your therapy that toxic environment, try to quit it, change it, move to another place, change your SIM card of your cell phone so nobody can get you again, so your dealers cannot offer you substances again. It's something that has to be said, something that has to be planned, something that has to be a deep purpose. Like, I really want to change the whole thing, not just the core that I think is wrong, but everything around. Yeah, the whole cabbage, not just the core of it.
Got it. So we get through the treatment, and we only have 3 minutes left for our acute aftercare, which is exactly when the exercises, the therapeutic engagement, the adjunct therapies are so important to really build the momentum that's come from that whole process so far. So Adriana, then what happens in terms of ensuring the protection of the benefits that have happened? Obviously, there's less risk, but we still need to ensure the efficacy and build on that safety. How do you partner with the coaches? How do you partner with the client's engagement with the technology? And then Deanne, can you help us understand how the coaches re-engage to ensure the maximum efficacy and continued safety out in the world of the stressors and of life? That's you, Adriana.
Of course, I will try to do it.
We have a few minutes. Maybe
Few
we
minutes
can
with a little bit of
go
time.
after 5 if that's okay. I want to make sure we have the questions answered as well. And
Yeah, so
Yeah.
after the treatment phase that Dr. Malacara was referring to, which is really catered and specific to each guest and each client, my job then is to get the insights that that client has obtained from the Ibogaine and this window of opportunity to sort of start setting up what Dr. Malacara was referring to a little bit and what Deanne was saying at the beginning, which is I think that the best preparation is to prevent, right? So if we've identified certain triggers or certain things that we do need to change in every aspect of their life, whether it's a job that is very stressful and that no longer serves my purpose after I find out, what or after I examine my life and through Ibogaine see it in a different way, start preparing that. And we make very specific notes and notations with the client. We start building it with them. After we do that, after 1 or 2 sessions post treatment in the acute aftercare process, then I will contact Deanne and her team of coaches to ensure them and to tell them how the experience was for that specific client or guest, to tell them what they've learned, where they're at now, where they were before, where they're at now, and where we need to go after that. So I will pass give a warm handoff in a sense to the coach that the client has been working with since the beginning in the preparation phase. So it's going to be the same client and there's going to be continuity, but it's going to be sort of what their process was here and where we can go afterwards, because the aftercare is the most important thing. Right now, they're feeling great, but it has to be long lasting. The only way to do it long lasting is if we put certain mechanisms and certain disciplines in place to continue this momentum that the Ibogaine has given them, or that the insights have given them. So I relay that information to Deanne and her team, and then the client or guest will continue working with a coach, have maybe a therapist put in place even before they come. Sometimes our clients already have a therapist appointment the day they go back, are looking into the gym that they want to start going back into. So we have those little things in place. And then with Yuriy's Homecoming app, it will remind them and keep them accountable, like Dr. Malacara was mentioning, which I think is important for the long-term goals.
Thank you. Deanne, so you've got the handoff.
Awesome. So yeah, I mean, with aftercare, like Adriana wonderfully said, I mean, it's really where the fruits of their work come into fruition. And there's a window of opportunity following Ibogaine treatment that is just so precious. It's so sacred. And we really want to help our clients to maximize the results in that window. And that window could last anywhere from 30 days to 90 days. And beyond, a lot of times people don't necessarily have a mark when it wears off, but there's a lot that can be done there. I mean, first off, what I'll say is there's sort of logistical things that need to be done in aftercare, and then there is the deeper work. And so as a coach, we're going to look at what the client really needs in that moment, because they really do come out in a different place. Some of them are ready to dive into their Ibogaine experience itself, and they really want to understand some of those breakthroughs and insights, and they want to see how they can implement that right away into their life, which is so great. That's really the fun part, when you get to unpack the experience and we get to see those gems and those insights, because there's a lot of direction that comes from Ibogaine. There's a lot of truths that come. There's a lot of insights and aha moments. And so if we can unpack some of those things and incorporate that into their intuition they already have, and the best judgment that they already have about what it is that they need to do, then comes the plan of execution. And so, like I said, logistically, you're looking at where are they going, who's going to be receiving them, what will be that immediate support system, that accountability system, what will be the priorities over the first few days and over the first 7 days and 2 weeks. It depends on who you're working with as to how much you will take on at one time. Some people are just like day-to-day people, and they just want to talk about what's today and what's tomorrow. Other people are very excited when they come out of Ibogaine treatment, and they're ready to just move on with their life, and they want to tackle everything imaginable. So in those situations, it might be actually helping them to organize things into priorities and to really look at, what are my goals from here? What are action steps and personal commitments that align with those goals? How can I put those commitments and action steps into a daily regimen and a weekly schedule? What kinds of things am I going to add to my life? What kinds of things am I committing to take away from my life? It can really help to look at some performance tracking measures, because the addictive mindset tends to look at what's not working and what's not good. So it can be really helpful to find any way to track progress. So in any of those moments of doubt or those lows, a coach can help somebody to immediately identify the progress that they have been having, because let's say there was a lapse or something like that, the mind could downward spiral. But when you have lots of different ways that you can track success, you can say, well, look at how well you've been doing in this area, and that area. And that can really help them to move smoothly through any kind of slip that they have. You're looking at you could help them get really clear around their sobriety goals. I would say that that is important. You want to do in the preparation phase, but you can be rehearsing that in the integration phase, because again, the mind will play tricks on people and they'll say, oh, well, I didn't really want to give up that substance. I only wanted to give up that one, or I only said I wasn't going to do it when I was at home, but it's okay if I'm out with these friends. And so the mind will start to make up other ways to look at this. And so it can be helpful to just get really clear with oneself, what are your sobriety goals and what are we committing to? And then, as we go through some of this logistical stuff, then we can start moving into the deeper work, the deeper cultivation, which could be somatic work, could be body work, could be mental work, could be spiritual work. There's just kind of a whole array of it. But what's important is that the coach helps the client to identify their zone of safety and their zone of security and reassurance in their recovery. And so it's like we have these, again, particular people that are set to be checking in each week. We have set activities, we have set commitments, we have set goal points or milestones. We have a safety plan if something happens to fall back on. So we really want to help clients have a mindset for success and a mindset for progress and practice, because it's not perfect. So yeah, I would say the aftercare part is a lot of fun. I would say the integration part's a lot of fun. And there are tests and challenges and different hurdles that people go through, but instead of looking at it as a setback or something unfortunate, you look at it as a part of the process. And like, how can we show up to this with the skills we've learned? And how can we show up with this with the mindset of growth and the mindset of overcoming it versus getting stuck at it? So there's just a few words around what we're doing in the aftercare process.
Thank you. Thank you. And so as we wrap up in the conversation today, it occurs to me that some of the therapists, some of the professionals that are with us today, or may see this in the future, may have questions specifically about how they can best utilize your expertise, Dr. Malcolm. What are some of the types of things that they might be thinking about that you could help them with in preparing their clients, preparing their own expertise, increasing their expertise to advise clients on your domain of preparation? How do they reach you? How do they utilize your services to help their client prepare for Beond or Ibogaine-assisted therapy?
Yeah, so like all the services that I offer through spiritpharmacist.com offer some educational courses and webinars, and they're usually, well, actually universally oriented in psychedelic pharmacology or drug interactions. So it's not necessarily very psychology focused. It's very kind of hard-headed and kind of nuts and bolts about drugs and drug mechanism, their metabolism, things like that. How can I help people? I mean, I said basically, well, a good intake form starts with screening, but, and then I rattled off some list of drugs, but that's just it. It's just a list of drugs. Like, what do you do when you actually have somebody that's taking one of these things? Do you just blanketly say no to them? Of course not. You think of ways that you can manage those types of medications so that they can undergo the treatment. And, if it's methadone, it's going to be transitioning to a short-acting morphine probably so that they can undergo the treatment. If they're taking an SSRI, particularly one that blocks CYP2D6, then we're probably going to need to taper that and stop it for some period of time before the treatment. People may be taking 3, 4, 5 different types of psychotropic medications, and some of them may be necessary and some of them may be things that they're taking because of their addiction. It makes them feel depressed. It makes them feel guilty. It interferes with their ability to sleep properly. And then they kind of have all of these auxiliary medications kind of piled on at the same time. So I think Dr. Malacara said it well, is like we're looking at changing not just the core, but the entire cabbage, and maybe even which cabbage patch it's growing in some periods of time. So this is a really big shift and a really big transformation that people are going through. And Ibogaine manages, it rapidly detoxifies people from opioids. I haven't seen that much information that it rapidly detoxifies people from all sorts of different psychotropic medications. So, they could emerge in a difficult place afterwards as well. And, it could be as simple as question as, do you think any of the drugs they stopped are contributing to the current picture? Do you think withdrawal is contributing, or maybe they're still experiencing side effects or more pronounced side effects to certain medications afterwards? And what do I do if I'm not feeling great 2 or 3 months later? Do I restart these things or not? I can't give any straight yes or no answers to a lot of these types of questions, because they really are individual situations, and that's kind of how I can help.
Beautiful. And so as we finish now, we're now 10 minutes over time. Yuriy, does the app, the Beond Homecoming app, go away when at some point? How long do you expect someone to continue to use the app for their continuation and benefit of their Ibogaine-assisted therapy at Beond?
Yeah, as I have already alluded in my previous answer, we do believe in integration as a continuous process that doesn't really end after some arbitrary number of weeks. So we do encourage that kind of habit building interaction with the app, so that people can continue checking in, continue re-engaging with the content that the Beond team has prepared, and continue building out their kind of self-awareness and community around the experience they have gone through, and strengthen the learnings of the experience through new habits.
Beautiful. Thank you. So we're done. We're out of time, and we really just scratched the surface. I mean, these things are always far more interesting and exciting, and it just provokes so much curiosity that we never have enough time. It's why we do this every couple of weeks. And before we wrap up, I want to give anybody on the panel or any of our attendees the opportunity to say anything in particular that you may feel the urge to ask or to contribute to the conversation before we adjourn. Did we miss anything from your perspective? How can we help you sign off and feel satisfied having conveyed everything you thought you should? Well, do we lose somebody?
Well, I would like to address just very quickly, if there's a doubt about any kind of condition related with psychiatry or cardiology or any of these big deals that involves Ibogaine treatment, I think peer review intake form will be the best way of finding out. Yeah, do not get only with the opinion of one single physician. Probably somebody has been misdiagnosed, and I don't think that would be fair to leave somebody out of the chance of receiving treatment. But definitely it has to be a team of more than two checking, reviewing, and determining if a patient is well diagnosed and because of that is totally out of the chance of getting the treatment, or it may be a chance for a client to be misdiagnosed, and we may be able to give them the opportunity to come, and of course, being reassessed and reevaluated during the process to determine the convenience or not of giving the treatment.
Okay, well, thank you for that clarification, and I think that's a great idea. It's been such a pleasure to spend time with each and every one of you. Thank you so much, Dr. Malacara, Dr. Malcolm, Adriana Figueroa, our head of psychology, Deanne Adamson, the founder and CEO of Being True to You, and Yuriy, Blokhin. Thank you very much from Homecoming.Health for joining us today, and for all of our attendees for your questions, for your attention, for your participation this evening or today, depending upon what time zone you're in or whenever you do see this video. We hope that it's satisfying for you. Next week on May 11th, we will be discussing the science of Ibogaine, and specifically how does Ibogaine work, with Dr. Joseph Barsuglia, a renowned expert in research related to Ibogaine and treatment. He's got such great experience, such great expertise, wonderful, compassionate advisor, practitioner, and an expert, as well as Dr. Bruno Rasmussen, who will be with us from Brazil. So it should be a great conversation. It should be very enlightening and insightful. And we hope that not only all of our attendees will be back with us, but all of our panelists as well. Thank you all for being with us. We hope you have a wonderful evening.
Thank you, Beond, so much for making this possible.
And we don't shut off the chat. If you guys want to hang out and continue the conversation for a little while, please do. Thanks everybody for being here. Thanks for joining us for Beond's Ibogaine Insights. Good night.